Dr. Annette Bosworth discusses her mom's miraculous cancer recovery. This is a Meet RX YouTube interview by Dr. Sean Baker. See meetrx.com and bosmd.com. Dr. Bosworth has an independent medical practice in Sioux Falls, South Dakota. Her recent book is Any Way You Can. She will be releasing a new book soon called Brains from Trauma to Repair.
I am internal medicine physician and born and raised in South Dakota, fifth generation prairie girl. There was a podcast in 2014 by Tim Ferriss and Dom D'Agostino, and they were talking about some of the protocols that the Department of Defense had kept them a national security secret for as long as they could. And then there was a point where there was a reveal of what the data was saying. And that's what Dom D'Agostino was talking about, saying there's this higher understanding of how to repair a brain through a state of ketosis. Led me to read the papers on when you have a Navy SEAL, which is a very valuable human being, but he is a weapon of human performance. When they have an injury, especially in their brain, how do you heal it? It blew my mind. It would take me at least 5 years to get the kind of outcomes they were getting in 6 months. So I actually closed the clinic for 3 days, which I'm an independent physician. If I'm not working, there's no money coming in. And that's kind of that's a lift. Went to the school library, the medical school library here in town. And 3 days later, I kind of come out of the paper mess and say, okay, I've got to be doing this. So I said, I'm going to do this on me. Oh my gosh. 3 weeks later, I still hadn't peed a ketone. I'm like, what the heck is the matter here? My mom has had CLL, or cancer over white blood cells, for over 10 years at this point. She's had chemo a couple of times. During that time, she's put on like 70 pounds. She's only 5'3", so there's not room for an extra 70 pounds. She's got some pretty big lymph nodes happening, and she doesn't feel well. She's been on antibiotics for 50 of the 52 weeks. And we walk into the oncologist's office, and right before the oncologist walks in, she says, honey, if the report comes back as cancer, I need you to know that the clothes I want at my funeral are on the top shelf in the closet in the basement. And of course, in walks the doctor. I don't get any time to say what. And the report came back as cancer, and we walked out of there with our pink slip to go get chemotherapy. And we're at a choice point in the hallway where one hallway leads to scheduling that appointment. The other one's the front door. And by now I've had about 4 months of just really looking at what the advanced teams are doing with the ketogenic journey. And I said, Mom, do you trust me? And she kind of flippantly says, oh, of course I trust you. And she knows there's a confrontational conversation coming, because the last thing she said to me was, I want to wear the clothes for my funeral on the top shelf in the basement. And I said, no. Do you really trust me with your whole life? And she said, with a little emotion, I do. And I said, let's go out the front door. Let me show you what I would do. We drove to the house. We cleaned out all the carbs. We did what I do with my patients now, which is a carb cleanse. You get everything out of the temptation zone. I do much of the approach for what I would use with other addictions like heroin or alcohol. Or when she was first diagnosed, those white blood cells went from like 40,000 to 80,000 over a 4-year period. Then it's a 2-year period. Then it's about a 1-year period. And when it's doubling every 6 weeks, you have a 6 months life expectancy. So she was doubling every 6 weeks at the point that we got that bad report. And her follow-up appointment was in 6 weeks. And like most busy clinics, the clinic didn't notice that she didn't come for chemotherapy. They just expect you to do that. And it takes us a long time for the doctor to come in. Like, I know something's going on. And before we walked in, I said, Mom, just don't tell them what we're doing. I don't have the mental fortitude to convince my colleague about this. So if he says anything, just shut up. Don't say anything. And in walks the doctor, and he goes, I had to have your blood run twice because I can't see that you came in for chemo. Did you come in for chemo? And in my mind, I was just hoping it hadn't doubled in those 6 weeks. I hope like maybe it increased by 50%. But he puts down the piece of paper, and the cancer had reduced by 30%, with 6 weeks of a ketogenic journey. Of course, my heart's just racing going, I'm taking this really huge risk with my mother. And that's really when I started saying, I can't keep seeing patients like this. I can't keep prescribing these drugs and doing this. I did Amazon self-publishing, push publish. I think it sold like 70,000 copies. And the audiobook is me reading it. And it's very interesting how well that turned out. And it's really helped people. Like, I believe I've treated more patients in, what is it now, 3 years of speaking keto and the science behind how to do keto than I did in 20 years of one at a time, internal medicine, pulling your hair out. We're going to do labs every 6 months, 3 to 6 months, and think I'm going to change your behavior. It's just, that isn't how it works.
Dr. Bosworth's mom is fully recovered, is in the best health of her life. Her book, Any Way You Can, is available on Amazon. Dr. Bosworth's clinic is in Sioux City, South Dakota. She provides information and services on keto and carnivore dieting at bosmd.com.